What natural treatments do you use to treat headaches and migraines? That's a question I was asked recently, and that's the question I'm diving into right now on Ask a Doc. I'm Dr. Michael Smith, a naturopathic physician who's passionate about helping you feel your best. And if you have a headache or a migraine, you can't feel your best. It just doesn't equate. The equation doesn't work. And I remember the first time experiencing a migraine. It was a couple years ago. It was as if the aura that I got right as it started was as if there was a waterfall in front of my eyes. Like I could see stuff, but it was like that feeling of looking through falling water. Then I went to bed and ultimately resolved, but I know that for many people, headaches keep coming, migraines keep coming. They're a big part of life, and they really take a toll on how we feel, how we act, our jobs, our work, school, so many other things. They can get in the way, and they're kind of nasty. I was looking at some statistics from the Centers for Disease Control. They did a survey in 2018 where asking how many people have experienced severe headaches in the past few months. It was interesting that about 20% of females and 10% of males had experienced a severe headache. That's a significant portion of the population. 1 in 5, 1 in 10, on average, that's fairly significant. And there's a lot that we can do, though. Some things might be trickier, but in this video, I want to dive into a little of the thinking that I have as a naturopathic physician of how I approach treating somebody with headaches and migraines. For the purposes of the video, I'm going to clump them together, headaches and migraines, although there's some nuances that make them different. For this purpose on this video, we're just going to treat them kind of the same way. So as a naturopathic physician, I am always thinking about what is the root cause of the symptom. In this case, the headache or the migraine. And in many cases, sometimes the headache is itself the cause of the symptoms. The nervous system, the brain is not working the way it should. There's different amounts of blood flow in the brain that can cause pain. There's lots of root causes of headaches. If it's confined to the brain, to the nervous system, we often refer to it as a primary headache, where the headache is what it is. But it's important to differentiate that between secondary headaches, where there's another something going on, and one of the side effects of that something going on is the headache. A few examples. If somebody has diabetes, or just are really sensitive to their blood sugar levels, and their blood sugar drops, maybe they forgot to eat or were fasting or something, maybe they get a headache from that low blood sugar. That's going to be different than somebody who, say, gets a headache because of severe amounts of stress, maybe finals week at school, maybe deadlines at work. There's just lots of things that cause stress in our lives. That can be a cause of headaches. Another cause of headache could be menstruation. People getting headaches around their periods. That can be a cause of headaches. So as a physician, when somebody comes to me with a headache, I'm going to first think about okay, what is really going on here? Is it the headache that's just there by itself? Or is there something else going on that's maybe causing a headache? And if there is, then I'm going to treat that something else and make sure that that's all good and normal, whether in this case, treating the blood sugar, treating the stress, helping with menstruation, support. I'm going to help with those things and intend that whatever I do to help with those things is then going to lead to better symptoms for headaches down the road. I really like this diagram. This is from the American Association of Naturopathic Medical Colleges. It was originally proposed by one of my old professors, Dr. Jared Zeff, and other amazing pioneers of the naturopathic medical field, in summarizing the therapeutic approach that I take as a physician and how I prioritize my treatments. So we talked about diagnostics. We're going to focus on treatments now. At the bottom of this foundation, the bottom of this pyramid is establish the foundations for optimal health. Now, if we're building a house or a big skyscraper or whatever it may be, we need a foundation on that building. If we put a lot of bricks or a lot of floors, wood, furniture, everything that's there in a building, we just set it on the dirt, over time that's going to compress and become unstable, and not gonna work very well. I'm recording this in June of 2024. I live in eastern Idaho, and if you've been following the news, you might be aware that over near Jackson, Wyoming, there's a highway going from Driggs, eastern Idaho, over into Jackson, and part of this road came crashing down because of kind of some landslides. And so the highway that connects these two places lost its main connecting road, and the detour is several hours. That affects people in my community right now. That road through the landslide and other things was lacking that foundation, in a matter of speaking, so it collapsed. And it disrupted the lives of so many people that commute to and from Jackson, Wyoming, from neighboring East Idaho. The same can be true for us. If we don't have our foundations solid, we're not going to be able to get where we want to be. And it's going to be hard. It's going to be rough, and it's going to change the way we live. What are those foundations? I always like to call them sleep, exercise. I like to say movement rather than exercise, but that's the common word: movement, exercise, diet, what we put into our body, stress reduction. If any of those things are off balance, our road's going to collapse. Our building's going to collapse. We're not going to be able to keep going the way we want to. And there's going to be disease or pathology that results from a weakened foundation. So that's where we start. We go up, stimulate the body's self-healing mechanisms. Our bodies know how to heal themselves. So if it's a cut on our skin, whether it's a liver that can regrow part of itself, our bodies can regenerate. They can heal. They're designed to do that. And that is one of the most amazing things that I can think of. So as a naturopathic physician, I'm helping stimulate the body's ability to heal itself. We go up from here. We support and restore weakened systems. If there's something that's weak, whether it's the GI tract, whether it's the heart, whether it's the lungs, the skin, whatever it may be, I want to support that. There's many remedies, whether it be herbal remedies, homeopathic remedies, hydrotherapy, nutrition, supplements, whatever it might be. There's lots of options. We have a huge toolbox. We can support that tissue so it's able to do its job. If it's weak, we can help restore it. I look at my friends who are who practice Chinese medicine, acupuncture, things like that. If there's a deficiency in qi, in that energy flow, according to Chinese philosophy, medical philosophy, they restore that. They restore the weakened energy that's causing the disease. We can address physical alignment. That harkens to the structural ability of the body. If our structure is not solid, we're not able to do the things that we want to do. After that, the middle top third of the pyramid is symptom relief. There's natural symptom relief, and then synthetic symptom relief. Symptoms are a big deal. If we have symptoms, it shows that our body is not working right. They're like that warning bells on a warning lights is rather the word I was looking for. Warning lights on your dashboard. Or if you have seen the movie like Apollo 13, when they run out of gas, the lights coming on, the loss of oxygen, the brakes are not working, the oil needs to be changed. Whatever the warning lights are, those are symptoms. Symptoms are important, and we try to, in my practice, I try to minimize symptoms as much as I can by addressing the root cause. But sometimes we really just need to suppress the symptoms. We can do that naturally. We can do that synthetically with drugs, and drugs do have their place, but I try to minimize their use as much as I can by prioritizing things that have lower risk profiles and side effects and things like that. There's many other things that we can do. At the very top of this pyramid is higher force interventions, which is like surgery and things like that, the heavy hitters. So when somebody comes to me with headaches, I'm looking at this possibly from all of these levels. If it's a really debilitating headache, sure, we can talk about symptoms. Let's just get that down. Let's help calm that down so that you can immediately feel better. But let's look at the foundations of health. What are you eating? Are you sleeping? Are you stressed? Are you moving your body? Are we stimulating the body's ability to heal itself? What can we do to support that nervous system tissue, that blood vessel tissue inside the brain that's causing the headache in the first place? What can we do there? And treating it very holistically as possible. So that's the paradigm that I use, the therapeutic order of naturopathic medicine, when I'm approaching any patient. In this case, it's headaches, but I can use this same thing for treating diabetes, for treating heart disease, for treating asthma, for other things like that. This is a pattern of principles that I use in my practice. We've talked about treating the root cause. Oftentimes, headaches or migraines are triggered by something. That could be light, that could be sound, that could be stress, that could be food, that could be situations. There's so many that could be physiology, like menstrual cycles, for example. There's so many things that can cause headaches. If it's a trigger that is modifiable, I want to work with my patients to help reduce those triggers as much as I can. We talked about strengthening the nervous system. There's lots of things that we can do there. There's amazing herbs that are specifically targeting the nervous system and in the ability for blood to flow and things like that. Some of the ones that I go to first when I'm thinking about headaches are two herbs, feverfew and butterbur. Now, butterbur, I also talked about in my Ask a Doc question about allergies, so you can check out that video for more information about butterbur. Feverfew and butterbur are great. There's many others as well. When needed, we can supplement. We can add things in a capsule or pill that you might otherwise get through your diet, but maybe for different reasons don't have as much of what you need. Magnesium is one of those supplements that often can help with relaxing the brain, nervous tissue, muscles, things like that. That's often used for prevention of headaches. Maybe not if the headache has already come, maybe not treating it, using it to treat the acute symptoms. But overall, it can definitely help holistically. And then when needed, we can tap this top part. The anti-inflammatories, the ibuprofen, the NSAIDs, the sumatriptan for migraines. There are many drugs that are helpful and beneficial. Do I default to those? Depends. Sometimes I might, and most of the time I try not to, but it's there. It's part of my naturopathic toolbox that I can draw from I can write a prescription for something. I can recommend maybe ibuprofen might just be the best thing for you right now. I can tell that to a patient. There's so many things that we can do, and it's really all connected through this therapeutic order. Of course, any treatment plan is going to be customized to the patient. That's why these videos are not intended as medical advice, because if I'm treating somebody, I'm going to really think about them, what's going on in their life, and then crafting this treatment plan accordingly. There are so many things that we can do to help headaches, and that's something that I love to do. I love to help people feel better. I love to help improve their quality of life. And that's why I'm making these videos, to be able to answer questions, to help give people different ways of thinking about things. To know that there's not just one right or wrong answer on how to solve things. It's not just medicine. It's not just surgery. It's not just herbs. There's so many things that we can think about and do in treating and helping people feel better. That's my goal. And if you would, I would invite you to just like and subscribe like this video, subscribe to my channel, so that I can be able to better help people like you know those different ways of thinking about things, so that when needed, you can feel better and live better and thrive better as naturally as possible in maybe different ways that you didn't know otherwise. So that is my answer to the question: what natural treatments do you or me, I, use to stop headaches and migraines? It's a complex question. It's a complex answer. There's no one right or wrong way for any one person. And that's the beauty of naturopathic medicine. That's why I'm here, and that's what I love, what I do. Thank you for joining me, and until next time, be well.